So metformin is the most commonly used diabetes medication taken by over 200 million people every day. We know it lowers blood glucose in people with type 2 diabetes, but research over the last decade or so has shown it also has effects on aging, cardiovascular disease, cancer, and potentially dementia and other diseases, and we really didn't understand why. We hypothesized that metformin would be acting on the liver to cause the release of an endocrine factor. We found using omics technologies that indeed in mice it caused increased expression of a number of proteins, and then cross-referenced that to people taking metformin and found that it caused increased expression of a protein called growth differentiating factor 15 or GDF15. Right now there's over 1,500 clinical trials testing the effects of metformin in a multitude of different diseases from autism to wound healing. So we think this has important implications as it might be a mechanism by which metformin may communicate to the rest of the body to mediate its beneficial effects.
The origins of metformin began with the French lilac, Galega officinalis. The guanidine compound that is extracted from it was used to synthesize metformin in 1922. Metformin was studied extensively for medicinal use by Jean Stern in 1957 to test its glucose-lowering abilities. Eventually, it was approved for marketing in the United States in 1994 and for use to treat type 2 diabetes mellitus. However, it was more extensively used in Europe even prior to that. It primarily functions as an oral drug that can be used in monotherapy or in combination with other anti-diabetic drugs. Metformin itself is a guanidine derivative that falls under the class of being a biguanide. Its official name is NN-dimethyl-imidacarbonamidic diamide, but in medication, it is often referred to as metformin hydrochloride. To synthesize this compound, Werner and Bell proposed a precipitation reaction between dimethylamine hydrochloride and 2-cyanoguanidine. Heating this reaction would yield metformin at a 96% yield and producing the compound that we see on the screen.
In regards to the pharmacodynamics of metformin, several effects have been observed. Starting from the top of the diagram, metformin uses the organic cation transporter 1 to accumulate in the mitochondria of the liver. Within the mitochondria, it inhibits complex 1 of the respiratory chain to suppress ATP production. This reduces hepatic gluconeogenesis because that process requires 6 ATP. So less ATP provided means that less glucose will be produced. Inhibition of the mitochondrial function also activates AMPK, which restores energy homeostasis. It does this by turning on other catabolic pathways that generate ATP while turning off cellular processes that consume ATP. Metformin also increases glucose metabolism in intestinal cells. This reduces glucose uptake and increases lactate delivery to the liver.
The absorption of metformin is carried out by a few mechanisms through different biological systems. Firstly, metformin uptake into the intestine is mediated by plasma membrane monoamine transporter, or PMAT, which is expressed on enterocytes of the intestinal wall. Secondly, metformin can also be absorbed into the liver via organic cation transporter 1, or OCT1, which is expressed on the basolateral membrane of hepatocytes. Lastly, the uptake of metformin into renal cells is facilitated by organic cation transporter 2, or OCT2, which is expressed on the basolateral membrane in the renal tubules. One unique aspect about metformin is that the drug is not metabolized by the liver, but gets excreted in its original form through multi-drug and toxin extrusion protein, or MATE, which is expressed on the apical membrane of the renal proximal tubule cells into the urine.
The most common approved medical use of metformin is to treat type 2 diabetes. From the graph, we can see over the past few years, the number of people who get diabetes is increasing a lot around the world, and among them, about 90% of the cases is type 2 diabetes.
Interestingly, recent studies have also discovered the new identity of metformin as an anti-aging drug, which can extend life expectancy. The secrets underlying the anti-aging property of metformin are associated with the age-related diseases that the drug is found to be effective against, such as cancers, cardiovascular diseases, stroke, and dementia. Based on recent analysis, metformin prevents the proliferation of cancer cells by inhibiting the activity of mTOR, which is a nutrient-sensitive serine threonine kinase, regulating the growth and metabolism of animals. Therefore, metformin has been studied to reduce the tumor growth in different cancers such as prostate cancers, colon cancers, breast cancers, and ovarian cancer. Some studies have also noted lower rates of cognitive impairment associated with dementia, as well as the risk of stroke among the elderly individuals taking metformin for diabetes.
There are two forms of metformin. One is immediate release oral tablet, and the second is extended release oral tablet. Usually, extended release version is preferred as it does not require patient to take as often as the immediate one, so patients may experience less side effects. One common brand for extended version in the market is Fortimet. Patient usually starts with 500 mg with evening meals once per day, and taking metformin with food can help prevent stomach problems. As every drug does, metformin also has side effects. Some mild stomach side effects, including diarrhea, nausea, flatulence. About 30% of patients will have them. With long-term usage, metformin can also lead to lower levels of vitamin B12 deficiency in the body, which in turn can cause anemia. Severe side effects like lactic acidosis will occur when there is a dangerous amount of lactic acid in the body. It's extremely uncommon, but patients who like drinking alcohol or has kidney, liver, heart diseases will have greater risk of getting it.
It's interesting to look at the market trends for metformin because type 2 diabetes is such a widespread condition. The prevalence of type 2 diabetes has increased worldwide. Between the years of 2000 and 2016, there was an approximate 5% increase of premature mortality due to diabetes. The increasing number of people affected by type 2 diabetes provides the metformin market with lucrative growth. The figure on the left shows the number of metformin prescriptions in the United States from 2004 to 2018. There was a peak of 86 million prescriptions provided in 2014. The figure on the right shows a forecast of sales from 2021 to 2028 in arbitrary units, where there is an expected annual growth rate of 6%.